Hi, everyone. Thank you for joining us tonight. Today, we're going to be talking about our Steady Steps fall prevention program through IRG Beyond Physical Therapy Services. My name is Holli O'Kelley. I'm one of the physical therapists here. I work at our Evergreen location. I'll let Lauren introduce herself.
Hi, everyone. I'm Lauren. I am a physical therapist at our Gateway location in Mill Creek.
Okay. So let me get these slides working. Hold on, I'm having a technological difficulty. There we go. Okay, so these are kind of the major points that we're going to be talking about today, why we created this program, how it works, what are the benefits, and how do you get started. Okay, so we definitely saw that there was a lack of high quality outpatient PT that's geared towards fall prevention specifically. And this became more apparent during COVID with the quarantining because people are staying home. A lot of people who may have needed therapy weren't getting therapy. And we had doctors calling and talking to our president and CEO, Shannon, saying, hey, we are having a ton of patients that are falling and a lot of them are not comfortable getting to a clinic, especially during a pandemic. So is there anything we can do about this? So Lauren and I developed this program to serve our community and basically improve access to physical therapy for people who are in these at-risk groups that may need physical therapy, but provided at their home.
So a little bit of talking about risk factors for falls. Falls are the leading cause of injury and deaths in adults over age 65. And that's a large percentage of the population in general, but a lot of the population that we see as physical therapists. Other risk factors for falling include the list that you see on the screen there, but a lot of them people aren't as familiar with. So urinary incontinence, if you're having to rush to the bathroom, especially at night. Polypharmacy, which means multiple different medications, and those interactions can have side effects that can trigger falls. Visual impairments, diabetes, decreased strength, decreased balance, functional limitations, arthritis, untreated pain. There's many, many, many things that can lead to falls. And then if you fall once, your risk for falling again doubles. So falling is the #1 risk factor for falling again. So it's a really important thing that we address this problem.
So this is kind of a quick overview of how it works, how to get involved. So our department, Beyond Therapy Services, receives the request for treatment. So that might be a patient themselves calling in directly, a family member on behalf of a patient, or a physician or a healthcare provider sending us a referral. So as soon as we receive that request, our team is matching that patient to a doctor of physical therapy that's in their area and that's qualified and involved in this program, and they schedule that first appointment. So on that day of your evaluation, the DPT, which is the doctor of physical therapy, they arrive at the patient's home and they go through a very, very thorough fall risk assessment. This assessment generally lasts from an hour to an hour and a half. So it's very thorough. It's longer than your typical PT visit, which generally ranges, 45 minutes on average. So it's very in-depth, and we really take a deep dive into any of the factors, whether it's internal or external factors that could be contributing to fall risk. And from there, the DPT is going to give that patient recommendations based on those results. And we'll talk a little bit more, kind of elaborate more on that right now. So on the right, you see kind of the first page of our fall risk assessment evaluation template. If you're a patient or a family member of a patient listening in, a lot of this might look a little bit confusing, especially towards the bottom. But what you need to know is that this is just kind of a glimpse into the guide that our therapists are using to do their evaluation. So they're going to go through a very, very thorough medical history and subjective exam, asking about, like Lauren stated, medications. How many are you taking? Do you have any incontinence going on? Because we can help with that as well. Diabetes, are there any medical risk factors that could maybe result in changes in sensation, numbness in the bottom of the feet, all of that type of stuff that could reduce your balance? And we'll go through, how are your eyes? How's your eyesight? And then are you having any of these factors that could increase your risk of falling, like pain? Is your knee painful? Is that why your leg is getting out on you? Because we can treat that as well. And then another really important part of our assessment is, and another great reason that we do it in the home, is that we want to take a really thorough look at the home environment. I can't tell you how many factors that we have caught by doing these home visits compared to treating a patient for balance in the clinic. It's just a whole nother level of thoroughness when you're in the patient's home, because you can really have the patient, take us through their daily routine. Tell us the parts of your home that you tend to lose your balance in. Is there a pattern? Is it always in your bathroom? Is it always at night? We really look at your home and give you recommendations, whether it's adding different lights, moving your furniture around a little bit, addressing some of the rugs, getting sticky pads under your rugs, taping cords. If you need any actual medical equipment like grab bars or an assistive device, we can recommend those to you as well and help you figure out how to get those. If you are using an assistive device, or maybe you're not, there are certain tests we can do to help determine whether or not that may be something you need, or whether the one you're using might not be supportive enough for you. And then we go through a really thorough assessment of what we call objective factors. So that's going to be a heart rate, blood pressure. We'll do an orthostatic blood pressure exam if indicated. So that means if you're a patient who tends to feel lightheaded and dizzy when you stand up too quickly or sit up too quickly in bed, sometimes that's due to a blood pressure issue. So we'll do a test for that if indicated. We'll do some sensation examination to the bottom of the feet to see how well you have feeling there. And then if there is any visual impairment that maybe has not been checked thoroughly recently by an ophthalmologist or optometrist, we'll do a full visual acuity exam, as well as what's called a dynamic visual acuity exam. So that's where we test for how well are your eyeballs able to focus on an object while your head is moving. A lot of people have problems with that when they get dizzy or they lose balance during walking. Some people describe that their balance issues only happen when they're walking in a grocery store. And that's actually a pretty complex activity. That's walking in a really stimulating environment with lots of moving objects that you're having to track. And you're walking and you're turning your head and you're looking at things on the aisles. So that's something that can definitely lead to balance issues, and we can treat that and give you exercises for that. And then the very bottom of the list is a bunch of stuff that's more on the clinical side, but these are all different outcome measures that have been researched. And when we perform them with the patient, it gives us a score. And that score can give us a more objective idea of how high the risk of future fall is. So that's kind of the deep dive into our evaluation on day one. Okay, and then after we go through all of that, then we start planning the treatment. So sometimes there's an external referral that's necessary. If you have an extensive list of medications that haven't been adjusted in a while, sometimes we'll recommend you meeting with your pharmacist, because they are very skilled at doing a medication review to see if there's any significant interactions between those drugs that might be going on. Optometrist is another one that may be useful. Nutrition, vitamin D deficiency is a high factor in fall risk and injury from fall. So nutrition might be something we refer you to. Like Lauren mentioned earlier, if you're having incontinence and that is causing you to rush to the bathroom in the middle of the night, consider pelvic floor therapy. That's something that a lot of people haven't heard of. Our company has several pelvic floor specialists, and that's something that we can help coordinate with you because there might be a reason like that that's causing your falls. And if we treat that, the fall risk will also go down. And then the plan of care, typically on average, we start seeing patients 1 to 2 times a week after that first appointment. And typically there are some strength impairments, decreased endurance, decreased balance. There typically are those factors present in most of the people that we see through this program. So we definitely want to do at least a consistent 1 or 2 time a week program for normally it's 2 to 3 months of that, could be less and could be more depending on how severe. But that way we can really work with the patient on improving those areas and train them on a program that they can do consistently and safely at their home once physical therapy stops. Some of our patients also may have a caregiver. If that's the case, we also will do caregiver training so that the caregiver can help us implement our exercises with that patient and help increase that consistency.
All right, so some of the benefits from this on-demand program. It's not the same as home health. These are trained outpatient doctors of physical therapy coming to your home to do the exam and then the treatment. We are the neuromusculoskeletal experts, and that's one of the huge benefits that you get from this program. Another main thing we wanted to address was barriers to treatment. If you can't come into the clinic for whatever reason, is it weather? Is it you are unable to drive? Are you nervous about the pandemic? That's been especially important this past year. So the fact that we can come to you really gets rid of those barriers. It's also very convenient. You can have a therapist come when works best for you. These therapists can treat any day of the week, times that are convenient. You can be comfortable in your own home. So that convenience factor, in addition to all the other benefits, is really special and unique to this program. The cost as well. We're trying to avoid unnecessary medical costs. So it's kind of a one-stop shop. Your PT will come in, go through that really thorough exam that Holly detailed, and we want to try to eliminate unnecessary appointments elsewhere. So if you need a pharmacist, we want you to get there. If you need an optometrist, we want you to get there. If you just need PT, then you don't need any extra appointments, and we can just treat that right then. And then in kind of a bigger picture, avoiding and decreasing medical costs associated with falls and injury from falls by preventing them in the first place. So overall, a really cost-effective way to treat this really large problem.
All right, so that's our big overview. We accept pretty much every insurance here at IRG. Another thing to remember is that IRG is a direct access state. And what that means is that the majority of insurances that we see don't need a referral from your doctor. So oftentimes you can call us right away and we can get you on the schedule. And that's that. You don't need to do that extra appointment at your doctor. We fax the first visit note to your doctor for them to sign off on anyway. So really all you need to tell us is who is your primary care provider or a different doctor that you want to list, and then we can get you scheduled right away. So here is our email address, phone number, and fax number if you're a physician out there. And so if you guys have any questions, let us know. And we're gonna take a look at this chat box here and see if you guys have any questions. Not yet. So I'll give it another minute or so. So again, we really appreciate you guys tuning into this. If you guys do think of any questions after this webinar is over, you can email any questions to that email address, beyondtherapy@irgptu.com, or call us and we're happy to talk to you. All right. Alyssa, can you talk a little more about how physical therapy can prevent falls? Okay, cool. Yes. So falls are very complex. As you can hear, there's a lot of factors that can cause a fall, but let's talk about what most people associate with falls, which is more of like poor balance. Balance is is multiple factors. Balance is vision, balance is your inner ear, and balance is also what's called proprioception, which is basically how the nerves in your limbs communicate to your brain to tell your body how to adjust. So an example of proprioception is like when you're walking on a slant, but you still remain upright. It's because your body is righting itself. So that's part of proprioception. The inner ear is the fluid and the canals in your ear that tell you your position in space. An example of that would be if you're on an elevator and you can feel when you start to go up. You feel that because of your inner ear and that fluid moving. And then vision, of course. Anyone at home, if you're safe, you'll notice that if you're balancing on one leg, it is significantly easier to balance on one leg with your eyes open and fixated on an object than when your eyes are open, but you're moving your eyes back and forth. It's significantly easier. So what that tells you is that we do rely on our vision to balance. So in our testing, we look at all of those factors and we can really differentiate which of those systems are not doing their job. And when we figure that out, we can give you exercises that really focus in on that one area so that everything gets better together. Multiple sclerosis, absolutely. We treat any kind of more of like the neurologic conditions as well. Multiple sclerosis, Parkinson's, any of that we can do, absolutely. Let's see. Yes, if you feel like something like this is of interest to you, but you don't think you need it to be at your home and you're mobile enough and comfortable enough getting into a clinic, you can absolutely just call an IRG location nearest to you. And we can do all of the same treatments that we would do in this evaluation in the clinic. The only difference is that you're not getting the home looked at itself. But yeah, absolutely. And if any of you guys don't know, what is the clinic closest to you, you can email us, or the IRG website has a pretty good map of the Puget Sound area so you can see what clinic is near you. Do you want to answer that one?
Yeah. Is there a PT for balance issues caused by inner ear problems? The answer is yes, definitely. There's multiple clinics specifically for IRG that have therapists that are experienced with working with inner ear related balance problems. The kind of cool thing about that is it's all dependent on what impairments you have. So almost any PT can help with balance problems regardless of where they're coming from. And what that would look like is at the first appointment, during the evaluation, the therapist will determine kind of what the list or the priorities are for that patient, one, and also from their objective exam. What do they think is most likely causing the balance problem? It's more often than not a combination of things, but specifically, like Holly mentioned, inner ear, vision, and then proprioception. And so we'll kind of differentiate that out and treat the impairments that you have. So most PTs at most locations will be able to help with this, even if it's caused by inner ear.
And I'll piggyback off that by saying that, this program is designed for falls prevention. But if we determine in that evaluation that the reason for the falls, or even if you're just having dizziness or something like that, if it is a vestibular problem, which is the inner ear type issue, then we have vestibular trained therapists. Lauren and I actually both do that. Then we would go into a whole nother type of evaluation that's also very thorough, so that we look at any of the problems that are coming from that inner ear, which could be related to the neck, the jaw, all kinds of things. It could be related to an inner ear problem itself, like a crystal stuck in a canal, or Meniere's disease, lots of different things. So absolutely, yes, Jacqueline. Can we talk about the fear of falls, which might not need therapy per se, but how to minimize this concern? Yes. So the fear of falls it comes from somewhere. Most people have a fear because they can sense that their body is not quite functioning in the same way that it was 5, 10, 15 years ago. A lot of that may be related to age, age-related changes. There are things that happen as we age that are normal physiological changes. Certain things slow down a little bit. Our reaction time is not going to be as fast as we get older as it was when we were 10 years old. So I would say, if you have a fear of falling, I wouldn't ignore it. I would at least maybe do a one-time evaluation with a therapist just to either validate that fear or build your confidence back that you don't have anything to worry about. But I would say if you have that fear, listen to it, at least do a one-time evaluation that's covered by your insurance. That way you can look at the whole body system and at least get an idea of where that fear may be coming from. Okay. Thanks, Pam. Ron, you raised your hand. Do you have a question? Are you able to type it in the box? Hey, Ron, I'm going to allow you to talk. Do you want to ask your, oh, it's not letting me. Sorry, Ron, my technology is not allowing me to let you talk on this webinar, but go ahead and type it in the box. And if you can't get that done, ask Lauren. Payment, is PT insurance benefit utilized same as other PTs? Yes. Yeah. Go for it, Lauren.
Yeah, so this program is billed the same as it would be if you were to come into one of our clinics. So none of that is different. It would all be the same from the patient side of things.
Yeah. That's one of the cool perks about on demand, is that there is no extra fee or charge or code that is billed for us going to your home. So us going to your home and doing a visit is going to cost you the same as what it would be if you came to the clinic yourself. I hope that answered your question, Carol. Anything else? I'll give it another minute, and if there's nothing, then we'll say goodbye and you guys can email us any last questions that you think of later. Okay. All right. Oh, here we go. Good job, Pam. Are there daily exercises that we can do in the meantime to help stabilize our balance? So yes, there are. Kind of for liability reasons and the fact that we haven't done that evaluation, it's really hard to give someone exercises without having seen them in person, because there are some very challenging exercises, and there are some exercises that might be so easy for you that they're not helpful. So the fear is that we would give someone an exercise that's higher than their current level of function, that's going to put them at risk for a fall. So I would say, Pam, if you are interested in that, email us directly, and one of us could even talk to you on the phone and ask you some questions. I can talk to you on the phone, ask you some questions, get an idea of your function. We also do, if you don't want to start formal therapy yet, our clinics do free injury screens. It's called an injury screen, but really it's a shortened appointment. They're normally about 15 minutes, but it's a short appointment. It's brief, but it gives the therapist just enough time to go through a quick movement screen. And that would give the therapist enough information to give you a few, 2 or 3 introductory things to try at home. So I think that would be the safest bet. Should there be mats on shower and bathtub floors to reduce risk of falling? Generally, yes, those are good things as long as they are not, as long as they are firmly stuck to the ground. Like anything on your floor, whether it's a rug or a bath mat, should be not stuck enough that a corner is not going to lift off for you to trip on. But otherwise, yeah, something that minimizes sliding would be good. Okay, and then let's see. Are all of our PTs DPTs? Margaret, I don't have an exact like percentage on that for you. The vast majority are DPTs. The physical therapy education through university programs has changed over many years. So if you find a PT working in a clinic that's, I don't know, maybe in their like 70s or something, 60s, 70s, they're probably going to have a bachelor's degree. And then basically some of them may have a master's degree, but the vast majority are going to have a DPT just because most universities have been doing that for many years now.
And if they don't, they often, it just means they went to school before the programs were doctoral programs. So often those PTs are, even though they aren't formally called DPTs, they have a lot of years of experience and are very skilled therapists as well, yeah, even though they don't have that letter behind their name.
Exactly. Yeah, they have so much experience that you're not going to tell a difference in the quality. PTs at Sammamish. Yes. Carol, yes. You got, go see Angela. She's fantastic. Yes, Alyssa already said that. Go see Angela. She's awesome. Okay. You want to do that?
Yeah. We'll start with, let's start with Bruce's question. Are there simple exercises to help with stairs? Yes. Like Holly kind of said, it's a little bit challenging to give exercises when we haven't met you in person or at least talked to you. Stairs are a tricky obstacle to navigate for people, and they're really prevalent in homes and in the community. So it's important to be able to do them safely. Again, challenging to give exercises over this platform, but that would be something, Bruce, that if you were interested in that too, either just a one-time appointment with a PT to go over that, give you exercises, progressions, skills to practice, or one of those shortened, what we call injury screens, but could just be a shortened appointment, 15 minutes, go over a couple things would be really helpful for that.
And, you know, when you're talking about stairs or to help with stairs, that could mean that you're having pain with stairs, or it could mean that you feel unstable on the stairs. And those are two different categories. So we would need to know, you know, if you're having trouble with stairs, what is causing the trouble? And then we can go from there.
I'll answer Rowan's question. How do you teach how to get back up? Absolutely. We want to avoid unnecessary or unwanted time on the ground. But if you do find yourself there, we want to make sure that you're able to get back up on your own, whether you need some help from a coffee table or a couch or just on your own in general. Getting back up is a skill. Also for if you just need to get on the ground, not a fall. If you need to get on the ground to clean something, to get something out of a low cabinet, to play with your grandkids, to any of those types of things, if you are on the ground, you need to be able to get back up, and that is just as important.
And Ron, I'll talk to you about pelvic floor work. So why is pelvic floor work important? So first of all, pelvic floor is very complex, but incontinence is the #1 complaint within the pelvic floor category, and the second would probably be just pain in general, pain with urination, pain with intercourse. But if let's say you're having incontinence, that is going to affect balance and fall risk, because those episodes happen any time of the day or night. I have several balance patients that with that issue who primarily have their falls at night. So we definitely want to address that. Any other questions? Sammamish site, I don't know. I think they're about 45-minute appointments at Sammamish. I think the majority of our clinics are doing 45-minute appointments, Carol. All right. Well, thank you guys so much for coming. We'll go ahead and call it a night. Again, please email beyondtherapy@irgpt.com if you have any other questions. And thank you again so much for joining us. Hope you guys have a great rest of your night.
Thanks everyone for listening in.
Thanks. Bye.
Good job, guys.